Well, good morning again, Council. Welcome to July. And I would ask Mr. Tifo to rise and report, please.
Thank you, Warden Marriott. Today, County Council met in camera for a period of 17 minutes to address 5 items, 2 involving collective agreements. Council provided staff instructions on collective agreements with our bargaining agent, Unifor Local 2003E and bargaining agent, LIUNA 3000. In addition to that, Council reviewed and approved its in-camera minutes of its meeting of June 2nd, 2021, and of its Committee A.M. and Committee P.M. in-camera minutes of June 16, 2021. And lastly, Council received a report and received the file that report concerning the security of Lambton County's property. That's all I have to report.
Thank you, Mr. Tifo. Brings us to item number 6, the Board of Health. Looking for Dr. Renaday to be on. Oh, there he is as we speak. Welcome, Dr. Renaday. We're ready for your update whenever you are.
Okay, can you hear me? Okay, yes. Great. So generally with these meetings, I try to keep it as brief as possible. Today, though, I think there's a lot going on, and I think we're sort of at a critical juncture. So there's a lot of information that I need to share with you at today's meeting. So if you'll bear with me, the cases locally are low. We've had our latest report had 2 in the previous day, and we have 1 institutional outbreak that we're actively following, and the vaccination program seems to be doing fairly well at this moment. And you know, our projected expectations are the next 4 to 6 weeks we'll be able to cover all of the second doses for people who receive first doses if the supply keeps up, which it seems like it will. And so that's also encouraging, right? But I think the larger picture that I wanted to share with you is really about vaccines in general and what we expect them to do and how that changes what we think the pandemic is going to look like. And so if you'll just bear with me, I'm going to share my screen with you. Some of you have seen some of these before, but this is an updated presentation. And so it'll be shared with you. Oh, that didn't work. Did it work?
Yep.
It did work. Okay, so you can see my screen now?
Yes, we can.
Okay, perfect. Thank you. So I think it's important to step back for a second and say, what have we been trying to do with the COVID pandemic response, right? And I think, you know, at least from my perspective, the 3 key things we've been trying to do have been to first prevent deaths. That was the major priority. Then to protect the health system so that health system providers can look after people with COVID and without COVID, right? That is, even in an emergency situation, we should still be able to get health care for things that are either COVID or not COVID. And finally, you know, doing things, multiple layers to reduce transmission of COVID-19, including variants. But that's really sort of the third one. The key has been to prevent deaths and protect the health system. Up until now, I think it's important to remember that we did all of these layered interventions in order to reduce transmission, because reducing transmission was the only way that we had to reduce the hospital burden and to reduce deaths. That is, we didn't have a mechanism to directly intervene to reduce the hospitalization rates and the deaths without trying to reduce transmission. And reducing transmission, as you can see and as you know from the last year and a half, is an incredibly challenging feat to achieve. It requires multiple layers of intervention that are consistently and appropriately applied all the time. And many of those interventions have their own risks and harms associated with them, right? If you think about lockdowns and the longer they go, the harder that is to keep up. And the only reason you're doing that is to reduce transmission in order to reduce the hospital burden and death, right? This is just a caution slide. I think it's important that you know that the graphs and things that you're about to see are estimates. They're not, some of them are numbers that are gained from the Public Health Agency of Canada, et cetera. But when we talk about the impact of vaccines, that's all estimates. It's all using what the information we have about vaccines to generate projections about what is going to happen as opposed to actual data, okay? So these are the hospitalization and case fatality rates by age in Canada throughout the pandemic. So it covers the entire pandemic. And you can see that this graph is is categorized on the bottom by age, right? So you have under 19 on the left, you have 80 plus on the right, and you can see for both hospitalizations, which are blue, and fatality rates, which are pinkish or whatever that color is, you can see a dramatic increase as you move up the age ranges. And so like I've been saying for much of this pandemic, the biggest risks of hospitalization and death, even, regardless of variants, regardless of people's chronic health conditions, are really in this, over 80 group and then the over 70 group. And it drops down quite significantly after that, especially the deaths, right? That's really, really important because those are the two big outcomes that we've been trying to prevent. This is just a graph that shows our local coverage rates. It's not as of today. Our coverage rates are a little bit better by age today, but this is from a few days ago. And so you can also see that there's a dramatic difference in coverage between the higher age groups and the lower age groups. And please don't mistake the 0 to 19 age group and think that that's a big drop. We actually have close to 50% coverage of the 12 to 17-year-olds, and the under 12s are not eligible for vaccines. So when you average them out, that's why it looks like there's a drop, right? But the main principle here is that we have high coverage rates in the age groups that are the highest risk of hospitalization and death, right? That's the key message from this. And so here's what you would expect to happen, right? So if we presume that the vaccines are about 95% effective at reducing hospitalization and death, then when I take the rates and apply them to our Lambton coverage rates, this is what we would expect to happen to the overall hospitalization rate. So you can see a dramatic drop in overall hospitalization rates in all age groups, but most particularly in the ones that had the highest rates to begin with, right? And so I think you can see from this graph where the dark blue is the hospitalization rate before vaccines, and the gray is what we expect the hospitalization rate to be after vaccines. Remember also that many of those people in that gray band are going to be unimmunized people as opposed to immunized people, right? So I think you can see that you get the most health system gains, you prevent the most burden on the health system by immunizing your folks who are 40 and up. And probably you could push that to say 50 and up. That's what really gets you the biggest drop in hospitalizations, right? And similarly, when you talk about deaths, it's the same thing. If you see most of your deaths in the highest age ranges, when you drop that by 95%, you're making the biggest difference at reducing deaths in the population, right? So you're going to get your most gains in terms of reducing death by immunizing your over 50 plus with 2 doses. And that's what we've done to a large extent and are continuing to do. It's important to note that when you look at that 80 plus rate and the 70 plus rate, those death rates overall might still be higher than an average influenza season, but many of those people in that group will be unvaccinated people, right? So let's take a look at this group here and say, how do these new risks or projected risks compare to other risks that people face in their 70s and in their 80s, right? That's a really important concept. We have to start talking not about COVID as if it's this separate risk, but a risk that now is compared to other risks that we face in our daily lives, right? So I found this graph from a preprint study. And what that means is that the data has not been sort of peer reviewed, but the point of this graph from these authors is to compare different case fatality rates by different age groups, okay? And so what you can see is that the COVID case fatality rate in red starts off very, very, very low and starts to go starts to increase dramatically as you get up in the higher age groups. And that's what I've shown you already. The point that these authors were trying to make was that if you look at the black line of motor vehicle accident case fatality rates, that once you hit about 40, okay, and you move past 40 in the age ranges, that if you have COVID, you are more likely to die from COVID than if you were to be in a motor vehicle collision, the risk that you would die from that. So that was the point that they are making here, that as you get older, the risks of COVID are still are dramatically higher than your risks of dying if you were involved in a motor vehicle collision. The other thing I want to point out just before I move on from this slide is the dashed bars across the side, which show you the case fatality rates for flu in the people who are over 65, and then you can see the case fatality rates drop by age band as well, right? So these are the key things to know before I move on. Here's what happens in the 70 and 80 plus age group when those people are vaccinated. So if their risks are now brought down by 95%, then in the vaccinated group, the case fatality rate should be at or near or maybe even lower than the case fatality rate from flu in that age group. And that's really important, right? Because you have to think about what are the interventions that we normally do for influenza. They're nowhere near the kinds of interventions that we've been doing for COVID, right? And if the risks really do drop to a level that matches what we expect from influenza, then that might signal that it is time to really approach COVID the way we approach influenza, which is to say that we don't do substantial case and contact management. We do outbreak prevention and management in specific settings, but not sort of more globally, right? And here's, I just want to just show you that in the United States, with millions and millions of doses on board, there's a very clear connection between increasing immunization rates, which are the bluey graph that's shaded underneath, and case counts going down, which is the gray graph that's shaded underneath. And as you can see in each of these age groups, so forget about the top left corner because the 12 plus age group is not eligible for vaccination. But in all of the other mini graphs that they've shown you here from the CDC, as you improve immunization rates in those age groups, you see cases go dramatically cases are dramatically reduced. And that's quite a significant time frame, right? You've got March and April and May and June and July that are covered. So this is a sustained drop in cases that we expect to see with vaccination, right? And that really changes the game in terms of what we're trying to do in order to control this disease. When we look around, the United States has lower vaccination rates than us, but most restrictions have been lifted in many places. The United Kingdom and other countries in Europe are experiencing a resurgence of cases, particularly the Delta variant, despite their good progress on vaccination. And some are actually considering renewal of restrictions that they had dropped. But I think that's because they're not sure about the impact on hospitalizations and deaths, right? Australia is seeing more cases despite their COVID-0 approach, and BC has lifted most restrictions as of July 1st, based on 70% one-dose coverage in adults, right? Different places are taking different approaches to this, but I think the main point we need to think about is that if the fatality rates in the vaccinated high-risk age groups are at or near the case fatality rates from seasonal influenza, there might be some limited breakthrough, but we can start treating this disease differently, right? We're going to know over time how long the protection lasts. It's probably quite a while, and whether or not people need booster doses and who those people are. My guess would be it's going to be people in the over 80 age group and people who have significant immunocompromise. That is, that they're on medications that really limit their ability to mount an infectious response. And you're going to see a little bit of breakthrough, but it's really not going to be substantial, right? So now that we have vaccinations, and if vaccinations are the key driver of reducing hospital burdens and deaths, we need to start rethinking the other interventions and try to understand what's the additional value of those things. And in terms of preventing transmission, what are we really trying to achieve at this point, right? So remember, fully vaccinated people can still get mild cases of disease. Remember that we've got some evidence that there's reduced transmission, but I think we need from vaccinated people to others. I think we need more evidence around that and more certainty around that evidence. And if we're looking at policy tools, it's important to remember that in general, where we're trying to improve coverage or uptake of anything, making the intervention the default option is always more effective than requiring people to actively opt in. And that's true for things like organ donation. It's true for a lot of other public health interventions, that making the expectation the default and having people actively opt out rather than opt in is more effective than incentivizing or promoting. But remember, in terms of thinking about how far we should push this goal of herd immunity, we do have lower vaccination rates with younger age groups, but also a much lower risk of severe disease. And if they are bringing disease back to vaccinated high-risk people, even their risk of getting severe disease is lower, right? So it might be important to keep high levels of collective immunity in some particular settings. So specifically congregate settings with at-risk residents due to their age, or operational disruptions that might occur in critical facilities if there was widespread illness. So if you had, for example, a power plant with a small number of staff who are skilled and cannot be replaced on short notice, you don't want all of them getting sick. And it might be reasonable to have interventions related to vaccination in order to limit operational disruptions. But I think in general, we probably need a bit more certainty around the transmission reduction impact of vaccines before we push too hard for higher coverage, because I think we've achieved the critical goals, which are reducing death and reducing hospitalization burden. And the remaining setting goals are actually such that, COVID isn't going to be over until essentially most of the world is vaccinated, and we have to pay attention to how that works. But you can't really make your decisions in this time frame based on the fact that all of the people around the world are not immunized, right? You have to sort of see where this goes and see what your goals are. And I think in terms of the major two goals, we've pretty much achieved those things. And so all of the conversation, I think that's all I have. All the conversation that you're going to see around this is really going to focus around how much should we hold on to the remaining interventions. There we go. Okay, you should see me now. Okay, so I just wanted to give you that heads up about where all of these conversations are going, what we expect to achieve with vaccinations, and I think how successful that's going to be, how it's really going to change the dynamics of this disease. And just highlight that I think this is a really critical juncture, right? Because we are getting a lot of people vaccinated, but there's still a lot of worry, I think anxiety in certain circles about variants and about what's going to happen overall globally with the pandemic. So I'll leave it there.
Thank you very much, Dr. Renaday. It's a good update. Councillor Stark, you have a question, as well as Councillor Bird.
Yes, thank you, Doctor, for the update. I heard a statistic last night that suggested that the Delta variant, or I should say the vaccinations, have a reduced effectiveness, efficacy down to 64% as it relates to the Delta variant. Can you comment on that, please?
Yeah, I think that information is still going to keep coming in, right? That's probably one study or one thing that people looked at. I think you also have to pay attention to what is it that they're talking about effectiveness against. And I think what I've been reading about the effectiveness of the vaccines against the Delta variant is that they may be less effective at preventing symptomatic disease in the Delta variant. So that is, you might still actually have a mildly symptomatic case of COVID if you were exposed, but still very effective at preventing the two big things that we're trying to do, which is prevent death and prevent hospitalization.
But would it be fair to say that if you contracted COVID after the vaccination, that you still can transmit the disease?
So I think it's fair to say that that's still an outstanding question, right? So I think what we know is that there's some evidence that transmission is reduced. We don't really know by how much. And we think that people who get infected after they've been immunized have a lower viral load, so that there's a lower chance that they would pass it on to others. But I think that evidence is still emerging. Like, we don't really have a lot of certainty around that aspect, which is why, rather than focusing on what the vaccines can do to prevent transmission, I'm right now really focused on what the vaccines can do to prevent severe disease in those who are vaccinated. That's where we have the biggest and most certain amount of evidence that it works.
Thank you.
Councillor Bird, please.
Thank you. Good morning, Dr. Renaday. Thank you for your presentation. So going back to the first or second slide where you were talking about your goals to prevent transmission, hospitalization, death, etc. What about coming back one step? Instead of what you're doing to avoid transmission, i.e. vaccination, what are you publicly doing or talking about to avoid contraction in the first place? I.e. diet, medications, supplements, whatever. What are you actually positively doing in that regard?
Right. So, I mean, I think the main message has been, it's a good idea to keep yourself as healthy as possible. There's limited evidence that particular dietary interventions or anything like that change the risk to you of either getting COVID or what happens to you if you are exposed to COVID. So the main prevention mechanisms have been keeping yourself away from other people, right? That's been the primary intervention, because that actually is the one that works the best. When you can't do that, then you layer the other interventions around you and you try to keep sick people away from each other. You wash your hands, you do all of those things. Those are aimed at preventing exposure, but by the far better bet is preventing what happens to you if you are exposed and reducing the consequences of that exposure.
So what do you suggest to people in general, just generally, to maintain a good, healthy immune system outside of COVID? Just what would you recommend to people? What are the best things to keep your levels up on?
Yeah, I mean, I think that there's emerging evidence on a lot of different things. The main message, though, because the evidence is always conflicting around specific interventions, the main message is, get, reasonable amounts of physical activity, right? Eat a balanced diet that has lots of fruits and vegetables and limited processed foods and all of those things that we've been talking about for years, right? Those are the things that keep you generally as healthy as you can be. And then on top of it, you add these layers specific to infection prevention.
Okay, thank you.
Councillor Rumbaugh, do you have a question?
Yeah, thank you for that presentation, Dr. Renaday. I'm so excited about this news. This is good news that we are now getting our levels down to the point where we have this is excellent news. The one thing I do have a concern about is the chart that you showed us where you were comparing the levels of cancer and the rates of fatalities on cancer specifically, but also heart disease. And there were some other things on there. Because of the measures that we've been taking to avoid having deaths from COVID, which I understand was necessary at one point, but now you're saying is not so much. We have a backlog of people, like every woman that I know of hasn't been screened for cancer in the past almost 2 years. So we do have to recognize that we have that backlog and that we need to be investing in getting those screenings back up, like breast screenings, like prostate screenings, like those are the main threats right now, as far as I can tell, based on that presentation that you gave. So I think we really need to be focusing our healthcare system more on that at this point.
Yeah, so I would say, I think that this is a big, ongoing discussion at the central level in terms of the province, but also at local health system levels about recovery and planning to rebuild all of that stuff. So that's a primary focus for them right now. It will take some time, and I think what they have to do is also triage those things. It's important that you remember from that other slide that there are some reasons why the case fatalities in those diseases are high that have nothing to do with healthcare. They are to do with properties of the disease, right? And so what happens with pancreatic cancer, for example, that was probably the highest one of case fatality rates, right? Is that by the time people are aware of any symptoms of pancreatic cancer, it's often a very advanced stage. And so there's very little that you can do about it. And there are no really effective screening tools for it. And so there are just some diseases naturally by the way they work. Once you've detected that disease, it's at a stage where there isn't much you can do and the case fatality is high, right? But in other cases, for example, with the motor vehicle collisions are a broad category, and there are some that are more severe than others, right? And so on average, the case fatality rates are low, but that's because there's a big range in severity, right? So you have to interpret that with a bit of context, but I think the real point is if the risks of COVID come down to something that's normal that we accept every day, like the risk of flu, then that helps us to start normalizing the rest of the health system and the rest of those things.
A follow-up, Councillor Rumbaugh?
Just a quick follow-up, and with the heart disease, we've been closing our gyms and limiting the amount of sports that people are allowed to do. Now that the risk is down, is it recommended that we can open up the gyms and get people back? I know I've gained weight throughout this whole COVID experience and I need to get back into shape or get moving again. Is there a push for that?
I mean, I think you're seeing a broad push for those kinds of things, especially when different provinces take different approaches, right? And so I think you can see that if you look over at BC, where most restrictions have been lifted based on immunization numbers that are slightly lower than ours, I think there's a lot of push, a lot of pressure, a lot of discussion from various stakeholder groups about can we just open things up, right? And I think you're going to see a lot of that happen sooner rather than later.
I think there was a question from Deputy Warden Hand.
I just wanted to say that not all diagnostics were shut down at Blue Water Health through the pandemic, because I myself was received some care throughout. So while I'm not talking about surgeries, I'm talking about the diagnostic section with the scans, some that was open. So there was still work going on.
Yeah,
Okay.
and I would just add that they triage, right? So what they do is they're looking at what's the risk, and I think a lot of preventive measures like cancer screening for asymptomatic people, those are going to get pushed off, right? Because they can be potentially delayed and then resumed versus things that are more urgent. So there's a triage process about what they keep active, keep going.
Yeah, a question from Councillor Arnold.
Thank you, Warden Marriott. Through you to Dr. Renaday. Just wondering if there's been much discussion around a booster for the COVID vaccine. I know I've had a number of questions about that, and they've heard some of the stuff on the media about it.
Sure. Yeah, thank you. There are discussions, but ultimately we don't really know. I think time is what's going to tell us whether or not the immunity wanes, just like we would know with other vaccines, right? I think probably if I had to, I try not to crystal ball these things too much because things change so much. But what we know about the immunologic indicators suggest that protection is really good for at least a year. That's what we've been finding in the people that we immunized about a year ago as part of trials and things like that. We're finding that there's really good evidence of at least that much protection, and probably it's longer. But I think that because of the risk of the potential for waning immunity in high age groups, and specifically immunocompromised people, and not just all, I think severely immunocompromised people really, you're gonna probably see a focus on obtaining booster shots for those groups earlier than anyone else when the discussion about booster timing is resolved.
Any further questions? Seeing none, want to thank you again, Dr. Renaday, for your update, and let you get back to your daily activities, and we'll talk to you the next time. Thank you.
Okay, thank you.
That moves us to delegations. I take a motion to allow the delegations. Moved by Councillor Ferguson, seconded by Councillor Weaver. All in favor? Opposed? That's carried. Our delegation, single delegation today is Stephanie Catrice, a resident of Lambton County, will be speaking to County Council regarding a request that immediate safety measures be implemented at Forest Road and London Line. Welcome, Stephanie. The floor is yours.
Thank you very much, Warden Marriott, and good morning, everybody. I see some familiar faces here in the Zoom, so that's great to see you. I would like to thank the members of County Council for allowing me the opportunity to speak this morning on behalf of our family. People throughout Lambton County knew the Paint Man. Many of you on council knew Bob and even had the Paint Man paint your homes. To his family, the Paint Man was a brother, son, uncle, stepfather, and grandpa. He loved hockey, music, animals, and traveling. On September 20th, 2020, my stepfather, Bob Hollingsworth, was heading to Country View Campground in Wyoming for supper to celebrate my sister's fiance's birthday. He had wrapped up a day of painting in Arkona and was looking forward to time with his family, something he enjoyed the most. While en route with his dog, Bob was struck and killed after a driver traveling south along Forest Road failed to stop at the stop sign. Two individuals parked in the lot at that intersection heard the crash, called 911, and ran to help. What many people do not know is that the 20-year-old running to the scene had no idea it would be his Uncle Bob's Paint Man van lying before him, or his beloved uncle whom he'd not be able to help. Bob's crash marked number 31 at that intersection in a 10-year span. There have been at least 3 deaths, with the 2 most recent occurring in 2016 and 2020. Both victims were residents of the township of Warwick. Both of those fatalities were the result of drivers failing to stop at the stop sign. There have been other injuries for the same reason, and these deaths were preventable. Since Bob was killed 9 months ago, there have been an additional 3 collisions, including one last month where a woman was airlifted to London. With 34 accidents since 2010, a serious crash occurs at Forest Road and London Line roughly every 3 to 4 months. A stop ahead sign and oversized stop sign have been on location for several years, with the existing ones in service since 2019. I was informed that at one time there were also rumble strips that a previous council voted to take out because the sound caused disturbances to some. Those rumble strips could have saved lives. I'm here today because my stepfather was killed at this dangerous intersection 9 months ago. Bob's death was preventable, and our family wants to stop further lives from being injured and lost. Simple changes can be made to improve the safety of this stretch of highway. It's low cost, can be done quickly, and it's the right thing to do. So on behalf of the Hollingsworth family, I'd like to thank Councillor Napper for his call for action and County Council for taking this issue seriously. It is clear to me and our family that this council is prepared to do the right thing and take action to improve safety at Forest Road and London Line. I've spent months studying this intersection and potential solutions to make it safer for all residents and travelers. And I respectfully request that you take action immediately before more lives are lost. Each time a crash occurs, the OPP files a collision report, which includes the cause of the accident. The police provide these to the county, and I was told last October a list had recently been provided. And these are also submitted to the Ontario Ministry of Transportation. 2 weeks ago, after learning about the county's motion to monitor the intersection, create a report that will be presented this fall, and also that the upgrades are due at this intersection the next 2 to 3 years, I decided to start a petition calling for immediate safety measure to be implemented. 2 years is far too long to wait. In 2 short weeks, this petition has generated 1,800 signatures, 1,654 of which were already submitted to you. Sarnia Lambton MPP Bob Bailey and Minister Monty McNaughton, MPP for Lambton Kent Middlesex, along with Sarnia Lambton MP Marilyn Gladue, have submitted letters of support. The town of Plimpton, Wyoming and Township of Warwick have also provided resolutions of support. This story has gained the attention of local media, and many residents are eager to see prompt action taken, as 6 pages of comments provided to you can attest to that. The overwhelming support for this initiative, including feedback in favor of this, makes it clear that Lambton County residents don't want to wait for another report to be received or 2 to 3 years for upgrades to take place. Ladies and gentlemen, I urge you to do something immediately. We have to do one of these things or some of these things, but we can't do nothing because more lives will be lost. I'm not here today to say you must do A or B or C, but I believe you need to do something. I and many others are willing to work with you to figure out what the right something is. I believe that at a minimum, rubble strips are a minimal start. And if the county decides to pursue a roundabout, flashing lights or traffic lights, then even better. But we know we need to do something urgently, so let's not wait. The risk of more lives being lost is too great. And I want to thank you for listening. I'm happy to answer any questions you may have. Once again, on behalf of my family and the many others who have been impacted by tragedies at this intersection, I respectfully call on your council to take immediate and necessary action. Thank you.
Thank you for that, Stephanie. Any questions from council? Councillor Napper.
I'm going to be very bold here, and after chatting with Stephanie and a lot of other people, and last night I got a call from Dr. Mathers, the coroner there, and her concerns. I know we talk about doing a study there and doing a roundabout and stuff like that. If I could find a seconder, I'd like to make a motion today that we put up flashing lights there immediately and pursue that intersection, because there's other issues that come out there. And I think a higher one is when you come out of Forest and you make that right turn to go on London Line, there seems to me there's a big blind spot there, but we got a long summer ahead of us. There's going to be a lot of traffic out there. Let's authorize staff or direct staff to put up the flashing lights immediately. And I don't think they're a big cost, but we're doing something and carry out the study there. But just to wait until we get a study or rebuild the road is not good enough, because I think there's action that's proven there. And if I get a second to that motion, I would certainly be appreciative of it. Thank you.
Okay, thank you, Councillor Napper. Councillor Rumboats, are you seconding that?
Yes, I'm happy to second that, word Marriott.
Thank you. Further discussion on this? Councillor Bradley, please.
Mayor Napa, are you including the rumble strips in that motion too? That can be done very quickly.
The rumble strips, I'm not a big fan of. We've had some history on them, and I've had people around there complain. To me, the lights should solve that problem out there. But if the study showed rumble strips, I would go there. But I'm not totally a big fan of. We had a problem there on in the past with them, and it takes a while to get them done. I was just looking right now what we could do now, and if rumble strips are in the plan coming future, we can certainly look at it at that time. But right now, Mike, I just love to see that flashing light up there before.
Okay, that's fine. I just wanted to clarify that what you were proposing. So
yeah, no, I'm proposing in the right away. I don't think there's a big cost. Jason can tell me the cost of them. It's something, and we're doing it now. I would hope to be up by next week. I'd get a little impatient, but it seems to be then we can do the study and see where we go from there.
Okay, we have several questions. First, Ms. Catrice has her hand up. Did you want to ask something?
Thank you, Warden. And I'm not sure if I'm out of line by raising my hand. I'm not too familiar with county procedure. And I thank Lonnie for his motion. One of the concerns for the family, and I believe your report should likely detail the causes for the accidents, but for us, because the driver did not stop, didn't see the stop ahead sign, will the flashing lights be sufficient if somebody's not looking?
Councillor Ferguson.
I'd like to just interject a little bit that the flashing lights at Highway 79 and 80 south of Alveston have worked very well. I don't know if it's the ultimate solution, but it can probably be done fairly quickly, maybe more cost effective. Rumble strips are nice too. I do realize people don't like the noise, but I think I would prefer a noise of a rumble strip over the sound of a collision. Thank you.
Deputy Warden Hand.
I was wondering if staff had a position on the effectiveness of just the flashing light, or does it require flashing lights and the rumble strips? I hate to go halfway if that's not the right solution. So maybe staff could weigh in on that. Thank you.
Thank you, Deputy Warden Hand. I see Mr. Cole is on. Mr. Cole, would you like to comment on that, please?
Through you, Mr. Warden. So we do have a rumble strip or an intersection improvement policy. Both rumble strips and flashing lights on top of stop signs are included in that policy. As part of that policy, we have indicated that where we feel the need to improve the safety due to failure to obey the traffic stop sign, so like blow through type accidents, that we will pursue a rumble strip option, and where residents within I believe it's 500 meters of that intersection object to the rumble strip, we will not put them in, and instead we'll go with the flashing light option. The flashing light option is a tool that is specifically designed for failure to stop at the stop sign, and it is a recognized tool as part of the OTM. To answer Councillor Napper's question earlier, they're not overly expensive. I think a pair at an intersection is $5,000. Now that they're solar powered, at one time we couldn't get solar powered options. They're fairly readily available. They're easy to install. We don't have to hook them up with an electrician or anything like that. So we can, if directed today, we can pursue acquiring two flashing lights to go on top of the stop signs and install them as soon as that would happen. As for the overhead flashers, like the overhead flashers above the intersection, that's a tool we've kind of drifted away from. It was an older standard tool that was used for highway design, and I think the guidance now is that the flashers on the stop signs provide a much more direct message. They draw your attention to the stop sign directly, And that would be probably the preferred option.
Councillor Weaver.
Yes, certainly support the flashing stop sign. I will not support rumble strips. I don't believe they are as effective, and I know they are quite a nuisance to those people living in proximity. With the flashing lights, will there be I know out on Airport Line out here towards Exeter, they have the flashing stop sign, plus back where the stop ahead sign would be, there's another flashing lights. Would that be included in this so that there's a warning before you get to the stop sign? It would be an additional, but also a solar operated double flashing light.
Mr. Cole, would you like to comment on that, please?
Sure, through you, Warden Marriott. Now, I'm not familiar with the intersection that you're referring to, but I think the primary point was that there would be an amber flasher on top of the stop ahead sign. That's a mechanism that is starting to be used. It's something that would be, you know, when we talk about roadway design, we generally want to stay within the parameters of driver expectation. That provides the best results. Certainly, having an amber flasher on top of a stop ahead sign would be a tool that could be applied there as well. I don't think we've applied that anywhere in our county yet, but it is something we've discussed in the past.
Councillor Arnold, you had your hand up.
Thank you, Warden Marriott. Just a comment around the rumble strips. I know along the Kimball Side Road where we've had a number of deaths and fatalities, they have rumble strips at those intersections and people still ran them. So I'm hoping that we'll get good success with the flashing light according to this motion. And if we need to do something more after that, let's take a look at it as what's been proposed.
Okay, Councillor Byrd.
Thank you, Warden Merritt. I just wanted to add to everybody's comments there that I personally like the rumble strips. I mean, sadly, there are many reasons why people go through red lights, flashing or otherwise. People can be tired, they can be talking, they can be listening to somebody else talking, they've got the music playing. But the rumble strips, and I do a lot of driving, I like them because we all get tired when we're driving from time to time, and those rumble strips really make you aware. That gives you advance awareness rather than waiting till you get up to the flashing light. So I'm very much in favor of that. But if we have a situation where both are not really achieving what we want them to achieve, then maybe we have to go back to other considerations like a roundabout or something else. But it depends on the severity. And as our speaker has mentioned, there's been too many accidents and things happening to be ignored. So I think it's a serious condition and we should really look at more that we can put there, not just a flashing light. I don't think that alone will do what is needed here.
Okay, Councillor Rumboats, you had your hand up.
Yes, I was wondering if the mover, Councillor Napper, would be open to adding the amber lights onto the advanced stop sign. And if he would be, I would be in favor of that.
Councillor Napper?
Yes, I would, but in the immediate thing, I just want to get those flashing lights up there tomorrow. And let's go there. Then we can do all these other things after, like the studies will come out and prove that, but let's get something there today, because I don't want to read the paper next weekend. There are 3 more people killed there or somebody hurt. And I think if you can't see them, you shouldn't have a driver's license. I don't understand. We got open intersections out there and people are still going. But that flashing light, I think I'm looking for something in the interim, and I also support going along, bringing your ideas forward later. But let's do something today. And I would certainly ask staff to give it the highest priority and get it done as soon as quickly. And I don't usually get this passionate, but today I feel in that mood. Thank you.
Okay, so the motion is updated to have 2 flashing lights, one at the stop sign and one at the warning that there's a stop sign. Are there any other questions or comments before we call the vote? Councillor Napper?
I don't want the flashing lights at the stop sign held up to get these other lights. If they can coordinate at the same time, but get the main ones up there and then do your best if you have to take another couple of weeks to get the other ones up. But the thrust of it is to, and I know Jason will do that. He's got a good crew over there, and he always seems to accommodate us.
Like he mentioned, Councillor Napper, the solar powered are much easier to install, so we'll leave that with him, whatever happens with this motion. Is there any other comments then before I call the vote on this? Seeing none, all in favor of the motion? Any opposed?
Can I have one more question?
That would be carried. Go ahead, Councillor Napper.
What's the timeline on this, Jason?
Through your Warden Marriott. I mean, as quickly as we can. Sometimes we have flashers hanging around, like to replace ones that have been knocked off of stop signs. I don't know if we have any in stock right now. So if you guys, if this council has directed me as they have today, I will be ordering flashers this afternoon. I expect them both to come in at the same time. And if they don't, whichever one's coming first will be going up as soon as they can, as soon as we receive the boxes.
Very much appreciated. Thanks.
Thank you for that, Mr. Cole. So thank you, Ms. Catrice, for your presentation again, and hopefully moving on this that quick will help the situation.
Thank you very much, Warden Marriott, and also to county councilors very much.
Okay, so moving on to item number 8, minutes of open session of June the 2nd. Is that a mover? Is that moved by Councillor Miller?
It is the motion to move.
Okay, and seconded by Councillor Broad. I think Councillor Weaver has a question.
Yes, just a clarification on the minutes. The vote that we took regarding the acknowledgement of ancestral lands, the vote that, I guess I wasn't clear on what we were voting for, and I voted no, but my no vote was for the rotational basis through council. It wasn't that the acknowledgement wouldn't be read at every meeting. So, and it's clear that we've turned down the rotating basis of everyone reading this at each meeting. But I may bring a motion back, a notice of motion for the next meeting, that this acknowledgement be read by the warden at each meeting. So it's not a question that anything was wrong. I think I voted one way, thinking that we were still going to read it at each meeting. It just wouldn't be rotated through all the councilors. And maybe others had that same thought. So I just may bring a notice of motion back at our next meeting, and which will be September. So thank you for that.
Thank you. Any other questions on the minutes? We have a mover and a seconder. All in favor of that? Opposed? That would be carried. Thank you. Moving on to number 9, correspondence. A, correspondence to receive and file. We have 5 items. Would you like to do those separately or all in one motion? We'll take motion for all of them then. Moved by Councillor Cook, second by Councillor Ferguson. All those in favor? Opposed? Oh, Councillor Stark, you have a question?
Yes, with respect to item B, the letter from John Pegg, the Ontario Fire Marshal, it's dated May the 26th. I wondered why that the report that comes later, pages 50 and onward, does not include this letter as part of that report. I found that rather unusual. I wonder if somebody could comment, please.
Mr. Tifo is going to comment on that.
Yes, thank you, Warden Marriott, to Councillor Stark. A good question. I anticipated the question given placement of that letter. First of all, it came in late for the submission of this agenda, and therefore the report that you see later in the package was drafted and in the package itself prior to receipt of the Ontario Fire Marshal's correspondence. Ontario Fire Marshal's correspondence was received by us about an hour late, but nonetheless, we knew that the issue was going to be on the table, and therefore obviously put it in the agenda for council's awareness and consideration.
Councillor Stark, follow up?
Yes, and I don't know if this is more appropriately presented when the report comes, but doesn't this letter not dramatically change the emphasis of the report?
Mr. Tifo?
Thank you, Ward Marriott, again to Councillor Stark. Yeah, we certainly acknowledge the report itself, but in direct response to the question as to whether or not it dramatically changes the report that you see later in today's package, and or any other recommendation that you would have seen prior to today's package, the direct answer to that is no. The reasons for that is, one, we've never disputed that any fire department of any local municipality can enter into any agreements with any party for mutual aid assistance or whatnot. Our position is that that cannot be unilaterally dictated, and so that's the difference here. I know that Mr. Pegg or whoever it is at OFM seems to suggest something otherwise, but that's the context. I'm not sure he suggests anything otherwise. The second piece of it is when we provided sort of third-party expert opinions on this, we provided what we believe is information that's quite well analyzed in terms of its content of the report. And we see that the author of this note does suggest that he or she supports the 14 TRAs that are in the 2014 agreement. But what's lacking behind that is the analysis for that recommendation. So why is it that you support 14 versus 3 versus 7? If I recall correctly, when Mr. Pancino was addressing this before his departure, he did provide in one of his reports to say, hey, look, in some areas of province, the TRA is 3 items, 4 items, 5 items, and for whatever reason. And therefore, with respect to this note, you would have thought that there would have been a little bit more analysis in terms of supporting all 14 versus anything else for that matter. And of course, then the note gets into another issue when we speak about objectivity. And that other issue is this notion that the author dives into whatever discussion would have taken place back in March of 2020 between Mr. Pancino and I think all fire departments in Lambton County, including the city, and dives into sort of factual arguments. And we look at that and say, okay, how objective is this? And again, we acknowledge the note, we acknowledge the position, but we stipulate and say, hey, county, when you dive into a factual argument of what happened in March 2020, we note that the individual never contacted the county for its information on that. So in direct response for those reasons, does it drastically change sort of the county's position on it? No, we acknowledge it, we get it. The county is still interested in having these discussions with the city. I know that unfortunately, our current chief has resigned, and that allowed an opportunity for perhaps a second look by whomever may be the successor to that individual. So sorry, that was long-winded, but that was the response I think that needed to be provided.
One more follow-up, Councillor Stark.
Yes, more a comment than a question. And that is when Mr. Tifo opened his discussion or in answer to this question, he made a very important point. He said that it is up to each municipality, and each municipality has the right to deem whatever is appropriate. That is what the city of Sarnia is doing. Thank you.
Okay, we have a motion on the floor. Is there any other comments before I call the vote? Motion received and filed. All in favor? And opposed? That would be carried. Moving on to 9B, correspondence from member municipalities. We have 4 of them. I believe Councillor Bird would like to address item B.
Thank you, Ward Marriott. I would like to move that Lambton County Council endorse this request from the City of Sarnia. If I can get a seconder, I'll explain.
Do we have a seconder? Councillor Bushy seconds that.
Thank you very much. So further to the last County Council meeting, a motion was proposed to Sarnia and carried, and a letter was sent to Doug Downey, the current Attorney General of Ontario. A letter was sent out from the city on June the 25th, and it was asking for consideration to be given to establishing a maximum rent limit for those individuals receiving Ontario Works and ODSP, because when their circumstances change and they have to move apartments, most of them cannot afford the extremely high current rents and will sadly soon join the ranks of homelessness, and unless something changes very, very soon. It's a very sad situation. So I hope that the County Council will endorse this as Sarnia has done. Thank you.
Okay, any questions on that motion before I call the vote? Important hand, please.
What I wasn't understanding was, so if someone has to move and they're moving to a larger apartment, what is the expectation on the rent? It's what they were paying, not what the new apartment costs? I'm not understanding.
Thank you for that point. So here's what happens. Let's say somebody's been living in an apartment for 10, 20 years, they've established their record, and let's say it's a couple, they're on ODSP or OW, and let's say anything that changes your circumstance, the kids leave home, you need a smaller apartment, or the kids move back home, you need a larger one, whatever. And you stay in the apartment building, but you request of the landlord a bigger or smaller apartment, even though you've already lived there 20 years or whatever, you then become, when you move, a new tenant. And as a new tenant, there is nothing that protects those individuals. The landlords can charge them anything they like, 50, 500, 5,000, there is no rule. But if they stay where they are, it's a 2-point-something increase that was frozen in place last year. So there's nothing to protect them when their circumstances force them to move in the same building they're already living in. And this is what we're trying to protect for them.
Okay, Councillor Rumbounds, please.
Just to clarify, you're talking within the same building itself, and
That's
what
correct.
would the limits? So the limit would be that they would get the same rent even though they went from a 2-bedroom to a 3-bedroom?
No, thank you for that point. They, if they move from their apartment to another apartment in the same building, they become a new tenant. And as a new tenant, there's nothing to protect them. They can be charged anything by the landlord. There is no ruling in place at all.
So what would we be proposing then?
Well, we're asking the Attorney General of Ontario to, under whom comes the Landlord Tenant Act, to look at this and put something in place like they have done if the people had stayed in the same apartment, which is the 2.2% increase or whatever they want to do. So they have to know what increase they're dealing with. They're only on a set amount of pension each month, so they have to be able to, you know, work everything out. If they don't know what the increase is going to be, they can't live like that. And this is a really big threat that these people, and I've had many calls from individuals who are affected by these circumstances. So they're really concerned that they will become homeless very soon if something isn't put in place.
Okay. Any other questions for the motion? Councillor Broad, and then Councillor Cook.
Thanks, Ward Marriott. I guess I'm just a little concerned. There's not enough information for me there today to support it. I'm not saying I won't support it, but today on the maximum rent limit, there's not enough detail in there. I have no idea what kind of rent limit they're asking for. You know, I guess I'm a little confused on that. I understand moving within the building, but I guess I don't know what they mean by a maximum rent limit. So at this point, I will not be supporting it today.
Councillor Cook, please.
Hey, thank you. Yeah, I guess just supporting what Councillor Broad just said. I guess I'd like to see a little more definition on what the maximum rent would be. Would that be the one established by the county, or what, you know, that would actually look like as far as supporting the motion? I'd like to support it. I just don't know if the way it is now, if there's enough evidence there to give substance to it. Thank you.
Councillor Bird, I'll allow you to answer that.
Thank you, Warden Marriott. I'd just like to respond there. So Right now, if these individuals stay in the apartment they're in, that's where they've established the record, they're in the building for 10, 20 years, whatever, they have got the 2.2 frozen % increase right now that was put in place last year, and it's still current for this year. So we're looking for the similar kind of a limit. If they move apartments in the same building, we haven't asked for the specific dollar figure because that's established each year, whatever the rent limit increase can be. We're asking that the same consideration be across the board. If it's the same tenant, whether they live in apartment A or apartment B, they should be treated as a long-term tenant rather than a brand new tenant.
Councillor Stark.
Yeah, I will support the motion based upon the fact that we are not looking at a specific increase. That is the reason that I will support it. It is the responsibility of the province to come up with the rules and the regulations. And therefore, what we're asking is the province to step in. So it's not our responsibility to determine what the percentage increase is going to be or what the dollar increase or what the base is. It's the province that's supposed to do that. And this is very much an appropriate motion. Thank you.
Councillor Miller.
Yeah, I guess my concern is along the same as Al Broad's. There are a lot of people who are working for minimum wage or something very close to it, who also can't afford an increase. So we're just talking a specific group here. I'm not sure that this is fair to the other people who all can't afford it either.
Any further questions before we call the vote? Councillor Rumboats.
I'm just concerned about the long-term impacts of something where we're taking a privately owned building and we're limiting what people can charge for the rent. As somebody who does own a building that is rented out, the restrictions on people who rent out buildings, homes, keeps increasing. Like, we can't increase the rent, we can't evict anybody who doesn't pay their rent. And I understand the reasons for those, but it gets to the point where you just say, well, let's just tear down the building because otherwise I'm paying for somebody else to live and I'm out of pocket money. And not everybody who owns a private building can afford to pay for other people to live. So I think we have to be careful with the restrictions that we're impacting. I'm not against helping out people, but private owners can only do so much. So then they get to the point where they just wash their hands of it and say, well, I can't make any money doing this.
Okay, so Councillor Bird, you have your hand up, but go ahead, please. And we can also ask for clarification from Ms. Colasanti if we need to.
Thank you, Warden Merritt. So further to Mayor Rombout's comments, I would just like to say that going back to the last County Council meeting when Ms. Colasanti made a very important presentation that was requested by Mayor Bradley, it was very interesting, and noting all the numbers that were quoted there and all the goals they have, what they're trying to do, all the things they're putting in place to help the total homelessness situation. This is what prompted the motion being put to Sarnia at their last meeting on June 21st. So we really don't want to add to the numbers that are already homeless. We want to help those that are already homeless. And this is one of the measures that we can put in place, because if we don't do anything, these people are really concerned. I've had many calls. These people are concerned that they will become homeless and add to those numbers that Ms. Colasanti has already presented. So I think this behoves us to do, it's one thing we can do, to ask the province to put something better in place. I appreciate both sides of the coin, but we've got to do something. Thank you.
Ms. Colasanti, is there anything you'd like to add to that, please?
Oh, thank you, Warden Marriott. Yes, there is. I'd like to thank Councillor Bird for her concern for those in receipt of social assistance and those who are experiencing homelessness. But I do have some concern with this motion. In speaking to staff, we're worried that this could complicate the working relationship we have with landlords right now when we're trying to place those in receipt of social assistance using our rent supplements and our housing allowance programs. What we may find is that landlords no longer want to rent to those in receipt of social assistance, and we already have a lot of challenges. So we are really concerned that this may hinder our effects. And council is aware that we hired a landlord relation worker late last year to work with us and the landlords, and we're starting to see some success with that program. And again, we're a little bit worried this may cause a setback. I think that in order to address those moving within a building, we could try to do some preventative work so that individuals aren't moving and this wouldn't happen. Certainly it does. I agree with Councillor Bird. This does happen on occasion when an individual is evicted and has to move somewhere else. We do see a huge increase. However, we're more concerned that this might hinder the work we're doing with landlords. And we heard that from some councillors here this morning. Thank you.
Thank you for that. Are we ready to vote on this? Okay. All in favor of the motion that's on the floor?
Can I ask Warden for a recorded vote, please?
Oh, okay. Request by Councillor Bradley for recorded vote. So I'll turn the vote over to Mr. Tifo. Unless Councillor Bushy, you had your hand up as well.
Oh, no, that's fine.
Okay. Mr. Tifo, please.
Thank you. So recorded vote on the motion that's currently on the table. The motion was moved by Councillor Bird, seconded by Councillor Bushy to endorse the recommendation that came through the city of Sarnia that you have there in your package. A recorded vote requested by Councillor Bradley, and we will start with Councillor Ramos.
No.
Councillor Ramos, I have a no. Councillor Stark.
Yes.
Councillor Stark, I have a yes. Councillor Weaver.
No.
Councillor Weaver, I have a no. Councillor Arnold.
Yes.
Councillor Arnold, I have a yes. Councillor Bird.
Yes.
Councillor Bird, I have a yes. Councillor Bushy.
Yes.
Bushy, I have a yes. Councillor Bradley.
Yes.
Councillor Bradley, I have a yes. Councillor Broad.
No.
Councillor Broad, I have a no. Councillor Cook.
No.
Councillor Cook, I have a no. Councillor Ferguson.
No.
Councillor Ferguson, I have a no. Deputy Warden Hand.
No.
Deputy Warden Hand, I have a no. Councillor Loosely.
No.
Councillor Loosely, I have a no. Councillor Miller.
No.
Councillor Miller, I have a no. Councillor Napper.
No.
Councillor Napper, I have a no. Warden Marriott.
No.
Warden Marriott, I have a no. Motion, the motion is defeated. 22-15.
Okay, so back to
18-15, sorry.
18-15 is the vote. So we have a motion to receive and file correspondence from member municipalities. All in favor of that?
No.
Councillor Loosely, sorry, you had a question?
Yes, thank you, Warden Merritt. I'd like to speak to the correspondence from the town of Petrolia. And I just wanted to, a key word in there is to look into the possibility of restructuring. And I know change is difficult, but I would like to ask that the county endorse the letter from the town of Petrolia. And I would make that motion to request that the county of Lambton endorse the resolution from the town of Petrolia.
Okay, we have a mover, Councillor Bradley, are you seconding that? Okay, we have a seconder, discussion. Councillor Stark and then Councillor Ferguson.
Yes, the move to reduce the numbers, I in fact support. The question is the actual mechanics of allowing that to happen. The province has moved to ask that only elected officials be designated as appointees to the conservation authorities. There are many smaller municipalities which end up being underrepresented, well, with this particular motion would be underrepresented based upon the fact that they only have one representative present. So with the understanding that many municipalities would be grouped together, who would be the grouping of the municipalities? Would those grouped municipalities end up electing a individual from those group municipalities? And along that same line, would we be looking at county council in that same context? If I could get the mover to address that question.
Councillor Loosely. You're on mute, Councillor Loosely.
Thank you, Ward Merritt. I think all of those questions will be considered. I think the intent of this is to look into the matter. It's not saying we're going to do that. It's to look into it and to look at whether there's weighted votes, whatever. It would have to be fair. But I think it's something that needs to be done. And I think we need to look into the different options. Thank you.
Councillor Ferguson.
I agree that the board is too large to be mobile. I kind of look at Brook Allison here having several waterways through the course. I have 3 different ones through my property as it is. I do not get impressed watching that somebody from an urban area can start voting on things that are happening in my backyard. And yes, you do have the river and the lake on your shores, but it's too unwieldy the way it is now. It needs to be moved along. I'd sent to the townships a suggestion to look at a farm group representative because of the depth of knowledge, the expertise that some of these groups can add into the board, which a local farmer, we don't really have the expertise or the quality research that's needed in the long term. I do support Mr. Loosely's suggestion that reducing it, and we'll figure out how to get it down to a size that is conducive to doing business.
Any further comments, questions before we call the vote? Councillor Loosely.
Thank you, Ward Merritt. I'm going to request a recorded vote, please.
Okay, requested by Councillor Loosely. Mr. Tifo, I'll ask you to please call the vote. He has the magic box out.
All right, so the motion that's currently on the table, moved by Councillor Loosely, seconded by Councillor Bradley to endorse the letter from the town of Petrolia with respect to the reorganization, or potential reorganization of conservation authorities boards. And the vote was requested by Councillor Loosely, and we are starting with Councillor Arnold.
No.
Councillor Arnold, I have a no. Councillor Bird.
Yes.
Councillor Bird, I have a yes. Councillor Bucci.
Yes, of course.
Councillor Bucci, I have a yes. Councillor Bradley.
Yes.
Councillor Bradley, I have a yes. Councillor Broad.
No.
Councillor Broad, I have a no. Councillor Cook.
Yes.
Councillor Cook, I have a yes. Councillor Ferguson.
Yes.
Councillor Ferguson, I have a yes. Deputy Warden Head.
Yes.
Deputy Warden Head, I have a yes. Councillor Loosely.
Yes.
So Loosely, I have a yes. Councillor Miller.
No.
Councillor Miller, I have a no. Councillor Napper.
No, of course.
Councillor Napper, I have a no. Councillor Ramos.
Yes.
Councillor Ramos, I have a yes. Councillor Stark.
Yes.
Councillor Stark, I have a yes. Councillor Weaver.
Yes.
Councillor Weaver, I have a yes. Warden Merritt.
Yes.
I have a yes. That motion carries 24-9.
Okay. So back to the, Deputy Warden Hand, please.
Sorry, can I just clarify that, so this review will come back to county before it's agreed to? Like if there's a final resolution in reduction?
I would say that it won't. It'll be dealt with at the Conservation Board.
Okay, thank you.
Okay, so the original motion to receive and file the correspondence, I guess it's appropriate.
C and D. Now we need a motion to receive C.
Yeah, so we have to revise that to C and D only. Councillor Bradley.
Yes, can I ask on the Conservation Authority motions that they be sent to the 2 MPPs and to the minister responsible, and not just depend on media reports, that they be sent to the government that has control over the final decision?
That would be a good point. Councillor Loosely.
Thank you, Warden Meredith. I would certainly agree with that as well. Thank you.
Okay, duly noted. So the motion to receive and file C and D. All in favor? Opposed? That's carried. Brings us to number 10, information reports. A is Finance, Facilities, and Court Services Division. Motion to receive and file. Or do you want to do both of them, A and B?
I so move.
Okay, thank you, Councillor Bushy, seconded by Councillor Bird. All those in favor? Opposed? That's carried. No items not requiring a motion at this time. So that brings us to number 12, committee minutes. I'll ask Councillor Rumbouts, please.
Thank you, Warden Marriott. I present the Committee A.M. minutes of June 16th, 2021 for Council's consideration.
Catch up to speed here. Number 1 is an information report on the blue box transition. Number 2 is report regarding oversized load corridor update. And number 3 is correspondence to receive and file. Number 4 is reports from Board of Health, Public Health Services Division to receive and file. Number 5. Number 6. Number 7. Number 8 is missing, so it's number 9 is adjournment. Councillor Rumbouts, please.
Thank you, Warden Marriott. I move that County Council accept the Committee A.M. minutes of June 16th as read.
You do have a seconder. Councillor Bird, all those in favor? Opposed? That's carried. So PM committee minutes, Councillor White is absent. Mr. Vice. Councillor Stark.
I present the PM committee minutes of June 16th, 2021 for council's consideration.
Thank you. Number 1. Number 2. Number 3. Number 4. Number 5. Number 6. Number 7. Number 8. Number 9. And again, we are missing number 10, but number 11 is adjournment. Councillor Stark, please.
Thank you, Warden Marriott. I move the PM committee meeting be accepted as presented.
Thank you. Do we have seconders? Seconded by Councillor Broad. All in favor? That's unanimous. Thank you. So that moves us to the Audit Committee minutes. Audit Committee minutes I chaired, and are there any questions or motion to receive and file? Councillor Loosely, please.
Thank you, Warden Marriott. I'd move that we approve the minutes as submitted.
Thank you. Seconder, Councillor Cook. All those in favor? That's carried. And number 13, items tabled from previous meetings.
Question.
Councillor
Bradley.
Well, on the audit committee, the question has come up about the auditors doing a large number of groups connected to the county, whether it be economic partnership or tourism starting in Lambton. And is that a good or a bad thing? I'm not sure I've had a clear answer on that.
Okay, Mr. Pelarchio, are you able to address that, please?
Through the chair, could you please repeat the question? Just
Yes, I mean, the question came up at the economic partnership about the fact that the auditors were doing almost all the groups connected to government in Lambton County, and whether that is a good or a bad thing. And then is it not in some ways a conflict of interest?
Through the chair, that's a very good question. As far as basically best business practices, always to review our accounting and auditors. It's something that I'm looking at right now and would want to bring back to our management group as to the best practices as far as what accounting services to retain moving forward.
Thank you. I'm not questioning their professional abilities. It's just the question was raised. Second question I just had on the same issue since we're up and running. Tourism Sarnia Lambton, does the county receive their audited statements?
I believe we do. That's all. We provide funding, so as part of that review, the audited statements are part of the conditional requirements.
Okay, thank you.
Okay, so moving forward to number 13, a motion to lift from the table, previous table motion. Councillor Bradley, seconded by Councillor Bird. Motion is lifted. Oh, sorry, all in favor of that? Opposed? That would be carried. Councillor Cook, no, you didn't have your hand up. How would you like to, Councillor Bradley?
Yeah, I will move the recommendation that's in the latest report, which would bring this back to the September meeting. And if I get a seconder, I want to speak to it too.
Okay, do we have a seconder for that? Councillor Stark? Go ahead, Councillor Bradley.
Yeah, just very briefly, we've got to bring this to a conclusion. I did not expect to see that recommendation, but I do understand, because it has been tabled multiple times, but I do understand why with a new individual coming into the position, and perhaps it can be approached in a different manner. But we do, when we get to September, we do need to bring this to a conclusion for the sake of everyone involved in it.
Okay, Councillor Rumboats?
Yeah, I just had a quick question, and I don't know if it's been answered throughout the reports, but if it could be in a future report, what it is that the firemen are allowed to do when on scene in order to assist. In conversations I've had with different paramedics, they have said that they are limited to what they're allowed to do. So I just want clarification on what they actually do when if they arrive at the scene before the paramedics.
Okay, I see Mr. Taylor is on. Would you like to tackle that, please, Mr. Taylor?
Sure, through you, Warden Marriott. Thanks for the question. So the history of tiered response agreements has been put in front of you. So with respect to what our fire does prior to the arrival of EMS, I have the deputy manager here, Mr. Jeff Brooks, who can answer that question.
Thank you. Mr. Brooks, please.
Thank you. Through you, Warden Marriott, the fire departments typically perform what would be considered first aid measures or advanced first aid measures. So primarily that would include CPR, choking, like procedures to clear airways, manage airways, and in some cases, some departments also provide oxygen for certain patients that under their protocols. Typically, those aren't necessarily our protocols. The patients that we provide, as an example, oxygen to are quite limited. We don't use it terribly often anymore. But fire departments sort of follow their own protocols, usually based on standard or advanced first aid.
Okay. Further questions, or are you ready to vote on this motion? Seeing no other questions, all in favor of the motion? Opposed? That's carried. And there is item 14 is notice of motion. There are none at this time. Number 15, other business. I believe Councillor Broad has something, and then Councillor Arnold.
Thanks, Warden Marriott. I would like to inform my fellow county councilors and residents of Lambton County that we have a non-euphemia resident, Nick Walmus, representing Canada at the 2021 Olympics in Japan in sprint cycling. I have been hesitant to mention as the Olympics were in question due to the pandemic. Although his hometown and residence is reported as Bothwell, he was born and raised in Don Euphemia and he resides in Don Euphemia. The sacrifices these female and male athletes, along with their families, is unbelievable as they work so hard to represent Canada at the Olympics. Imagine the emotions and the stress of being told there would be no Olympics in 2020 due to the COVID after all that training. I would ask that my fellow county councilors and residents of Lambton County and across Canada, please join Don Euphemia residents in cheering on Nick Walmus as he represents Canada in sprint cycling at the 2021 Olympics in Japan. Thank you.
Thank you for that, Councillor Broad, and all the best of luck to Mr. Walmus. Councillor Arnold, you had your hand up.
Yes, I did, Warden Marriott. I'd just like to make a suggestion that we send a letter of congratulations to our new Governor General, Ms. Mary Simon. I think it's wonderful that that we have someone of her caliber that's been selected to take this wonderful position for us all, and that there'll be a close relationship with the Crown, and hopefully we can get some of these sensitive issues that have been long plaguing us dealt with because of her involvement.
Okay, that can be noted and done. Councillor Broad, did you want a letter from the county to Mr. Walmus as well?
I think we'll wait till after the Olympics and send him off something. Then he won't be receiving it. He's got a lot on his mind right now, and let's give him a chance to go there and perform for our country.
Okay, Councillor Loosely, you had your hand up.
Yeah, Warden Marriott, just, we can certainly wait, as Councillor Broad stated, but I was thinking of sending him just a little note or a motion from County Council, wishing him the very best in his, in the Olympics. Just, I thought it might be a little bit of encouragement to give him something now, that's all. And if Mr. Broad's okay, I'd certainly move that we send him a letter now, wishing him good luck and all the best in his competition at the Olympics.
Okay, do we want to make that a motion or just a recommendation?
Well, unless Mr. Broad does not want to do anything now, I just thought it might give him just a little bit of encouragement, just to wish him good luck on behalf of the County of Lambton.
Yeah, I don't have a problem with that, and if you want to send a letter off to him, that would be awesome. And by all means, I'm not sure it needs to be a motion, but I think that's just a recommendation. I'm really cool with that. Thanks.
I would make a motion, Warden Marriott, just so, it's official kind of thing rather than just a letter off the cuff.
Okay, do I have a seconder for that? Councillor Broad, all in favor? That would be carried. Thank you. That brings us to, if there's no other business, I'll move to 16, Notice of Bylaws. Mr. Tifo, please.
Yes, thank you, Warden Barrett. It's moved by Councillor Miller, seconded by Councillor Broad, that bylaws 15 and 16 of 2021 as circulated be taken as read first and second time.
All in favor? Opposed? That would be carried.
Thank you. It's moved by Councillor Broad, seconded by Councillor Miller, that bylaws 15 and 16 of 2021 as circulated be taken as read a third and final time.
All in favor of that? That's unanimous. Thank you. That brings us to number 19, adjournment. As noted in the bottom, we next meeting will be September the 1st. Motion for adjournment, please. Councillor Loosely, Deputy Warden Hand, all in favor? That's carried. Thank you and have a good rest of the summer.
Have a good summer, everyone.